Good morning, and I'm very pleased to introduce our speaker this morning, Gina Pruitt. Gina is the member in charge of the Risk Assurance and Advisory Services practice of KraftCPAs. Her responsibilities include a lot of things, including risk management, internal audit, system and organization controls or SOC examinations, PCI DSS, which is Payment Card Industry Data Security Standards Compliance, IT Auditing and Consulting, Network Security, and Vulnerability Assessments and Cybersecurity Controls Consulting. Gina participates in a lot of organizations and in several leadership positions. Just to name a few, she is on the Information Management Technology Assurance Executive Committee of the American Institute of Certified Public Accountants, and also serves on the Cybersecurity Subcommittee. She is a member of the Tennessee Society of Certified Public Accountants Cybersecurity Task Force, participates in Leadership Healthcare, and is on the board of directors of the Nashville Technology Council. This presentation will also qualify for continuing education. So during the presentation, Gina's going to share some code words with you that you will need to document your attendance and to get your CPE credit. And now I am so pleased to turn this over to Gina.
Thank you, Lucy. Good morning. I'm glad to have everybody here, and I'm sure that everyone is glad that they did not have to get out and come in person and get wet in the rain. I got wet this morning myself, but I'm all dry now. So we'll get into this topic that everybody is very concerned about. We've been concerned about it for probably about 10 years now. And cyber risk is it's a real thing. It's not going away. And healthcare tends to be one of those industries that it keeps getting worse in. So we'll get into some of that. Let me show you what we're going to cover. So today we're going to go over the current state of cybersecurity. I've got some information that was done in a study that's been done for several years now, and healthcare data is very important in this study. So we'll go over that. We'll talk about some of the typical cyber breaches and the causes for those in the healthcare industry, and just why is healthcare data important to hackers and people who are trying to get the information. And then we'll talk about how do you reduce the cost and risk of cyber incidents, like what are the mitigating factors and some of the controls that you should have in place or look for your IT people to have in place. You'll note here on this slide, some of the information that I am going to provide is coming from the Ponemon Institute Cost of a Breach report. They do a study, the Ponemon Institute does a study every year, and they commission IBM Security to do it. And they do it for about 17 industries are covered and about 18 countries are covered. So this information is based on that study for 2021. So it's very current. So overall, the US leads all countries in the average cost of a breach at $161 per record. That's pretty high. And I guess it's no surprise that the United States leads this. The United States has actually led the cost of a breach cost for about 11 years, as long as the study has been done that I'm aware of. The average cost of a breach rose about 10% in the past year. It was the single largest increase in the past 7 years. And healthcare is one of the highest, if not the highest cost per breach. For the 11th year in a row, it's $180 per record. So all other industries bring that average down for the US to 161. Healthcare is at 180. But I thought the big important thing to get across today is it was a 29.5% increase over 2020. That is a huge increase. And a lot of that, I think, does relate to the pandemic and people working more remotely and having access from their homes, potentially where they don't have as secure an environment as you would in your work location. So that is something I think the technology industry is really going to have to put some time and effort into. But you can see it went from 7 million to over 9 million. To get into some details, the average number of records in the United States that are breached is approximately 26,000 records. If you look down there at the bottom, the average number for a healthcare breach is just over 51,000 records. And that's a lot. It's a big difference. It's about twice as many for healthcare breaches. I spelled that out for you a little bit and just show you the numbers. So the average for a breach in the United States overall is about $4 million. If you take that 26,000 records times the 161, but for a healthcare breach, that's how you get to that 9.23 million is 51,000 some odd records times $80 $180 a record gets you to that number. That's not every company, but there's some big breaches that we've seen lately. And usually when you have a healthcare breach, there's a lot of records involved, and I'll show you some of that as well. So approximately 70% of those records included personally identifiable information. So PII, PHI, all encompass about 70% of the records. The average cost of a breach for companies these days is about 5.54 million, and that's considering 80 to 100% of the employees working remotely last year. The 2021 study encompassed a portion of 2020, and we all know everybody was working from home, or most of the people were working from home at that time. I know a lot of people in healthcare have to be in the office, and so that wouldn't necessarily pertain directly to healthcare, but in general, those breaches were significantly more due to people working remotely. I did want to cover what a mega breach is like, and usually a mega breach is what we have in healthcare. So that's somewhere around 50 million to 65 million records. You see that the Anthem breach some years ago was 80 million records. So I was just trying to give you something to compare that to. But that makes it over 401 million. That's a high cost. All right, our first code word for your CPE is cybersecurity. I'll give you a moment to write that down. So what are the common cyber breaches and causes? Let's get into that a little bit. I'm sure a lot of you have heard of social engineering and specifically ransomware. Ransomware has been around for several years, and it's been a big type of social engineering tactic for the healthcare industry over the last couple of years as well. Malware just being issues within a software where someone has gotten in and putting some malware into your system. That can be done through just the same way as ransomware, an email that has a link in it where they're capturing credentials, or they're getting you to do something that you shouldn't do by social engineering. And social engineering just means that they know something about you. They know enough about you that they can get you to click on that link. They may have actually even gotten credentials or changed their email address so it looks like it's coming from someone within your organization that would be asking you to do something that would be typical to you, but it requires you to click on a link. And they can, through that link, either provide some type of ransomware attack or some type of software inserted into your system that is called malware that will do something either then or later. A lot of times these breaches don't occur, or you don't find out about them till much later, sometimes over a year. They can sit in the code of a program and not do anything for quite a while. And then at a certain point, it's set up to actually cause damage. And so there's opportunities here for us to control it and to find it before that happens. Ransomware, on the other hand, not necessarily going to wait a while for that. They're going to probably take ransom at that point. And when they do that, the best thing that you can do or have done to be prepared for a ransomware attack is to have good backups and have a good backup and recovery program. We'll get into that in a little bit later, more details. Third-party software vulnerabilities. So all of us use third-party software. We use some kind of software for patient billing. We may use some type of software for, setting up our accounts payables and receivables. And there's also software for scheduling patients. Any of that software that has to tie to another piece of software in your network could have errors or loopholes in the programming. It's not necessarily intentional. It's just that through the testing of that software before it went out to you, that loophole was not found. Somebody found it after they started using it. And so then that software company is going to send out a patch. And that's what we call patch management, as being one of those key controls that we suggest that you have a good patch management program in place. So whoever supports your system, whether it's a third-party network support vendor or it's somebody in-house, you need to make sure and ask the questions about how do you patch our software and make sure that any security loopholes are being managed. We find that this is a really weak area for most companies. I would say 90% of the companies we go into do not patch their software timely. And you've seen some of the breaches that have occurred. They've mainly occurred because there was a loophole that other hackers knew about, and they're going to go to the weakest link and try to get in there through those loopholes. And that causes the breaches to occur if that software is not patched timely. And then there are accidents. There are accidents, they're intentional compromise by employees or contractors or business associates. You could also have lost devices. Somebody could take their computer home if they have a laptop and they could lose it. I know several people who have left their computer in their car and their car got broken into and the computer was taken. I know our IT people have the ability to lock our computers. So if someone stole it, they can lock it, just like your iPhone. If you have an iPhone or an Android, your internet or your provider for your service, phone service, can actually cut that service off so that whoever stole your phone can't really do anything with it or get to your data. But you have to ask for that to be done. Same thing with computers. If it's not set up to be done that way, they have to go in there after the fact and do it, which the data may already be breached at that point. So what causes breaches? We've talked a little bit about this previously, but when you don't have antivirus software or a malware software that looks for these types of attachments or links, or can look at your phishing emails as they are coming in and put them off to the side so you can't even open them. Many of you probably have those systems in place, but sometimes they get through. And that could be because that antivirus software or the malware software is not being maintained, meaning the updates and upgrades to that software, just like patching a software, you have to keep those updates going. You have to keep implementing those. And sometimes I see on my side, I see, oh, do you want to do the upgrade? Many of you probably had those little pop-ups that say, do you want to upgrade XYZ software right now? You know, like, I'm too busy to do that. I don't want to do that. And you put it off and you put it off. Hopefully your IT people are doing that at night when nobody's on the computer usually. But sometimes those things do pop up during the day. And next time you see one of those, think about the fact that when you don't run that update, you're leaving a hole where possibly malware or some type of other attachment could get into your software and it wouldn't be caught. So try to always do those. If they pop up, find a time later that you can do it. Delay it for an hour or two so that you can get back to it and put the install in place. Or talk to your IT people and say, hey, can you have these automatically to install when nobody's here so that people don't have to do it themselves. The system will just do it when the computer is not in use. Ransomware actually encrypts records. And so, and that's sort of confusing. In the healthcare industry, we encrypt records anyway, or most of us are encrypting records. Encryption is a big part of the controls that are required by HIPAA, for instance, by the high-tech rules. So encryption is already happening, but when ransomware comes in, they encrypt what you already encrypt. And what that means is they can't get to it usually, but you can't either. So they take control of those records until you provide them with the ransomware that they want. And you can call the number and the people will be really nice. They're usually they're in some other country, and it's like a call desk, you call in and they say, yeah, we'll take credit cards. It's just a very lucrative business. And when they're in other countries, it's very hard for the FBI or anyone in the United States to get control of it. And so the best thing, again, that you can do there is have a good backup plan where you can revert to backups when your system gets tied up with a ransomware attack and it gets encrypted. You can just basically back up, reinstall the backup from yesterday, for instance, and then you're fine. But you may lose some of the work that you've done that day. It's a lot better than losing it for weeks or not being able to get that information back. But ransomware often can be thwarted by giving training to employees, giving them adequate training, giving them some scenarios, helping them to learn things like hover over the email address. And even if it looks like it's coming from, say, your accounting manager, maybe it's not. If you hover over it, it'll tell you where it's really coming from. And if you're questioning it, you can pick up the phone and call that person. We don't use the phone very much anymore, but sometimes it's better to just do that. Either pick up the phone or hover over that email address and see if it says something that is totally not readable or understandable, because that's what they usually look like. They're just very confusing when you look at them and you think, I don't know who would send me that, but it's not my accounting manager. But the training is important because ransomware evolves over time. So does malware. And so you have to continually train employees about new ways that attackers are trying to gain access through these social engineering, phishing emails, and links that they send. They're getting very good at copying information so that it looks like it's from someone that you would normally be talking to. So just be very careful with it. And if you're not getting the training that you feel like you need, I would push back on the IT people, because IT people are the ones that really know what types of attacks are happening and how to train you on what to look for. I will say that what I see in healthcare most is the senior management and executives and physicians really don't like to do training. They don't feel like they need to do training, but they do. They really do, because they're going to also potentially get these types of emails. At some point, these emails are going to be set up so that if you even open them, there's going to be something happening in the background without even a link. Or attachments, they may be expecting an attachment and they may go to open it and then it won't open and they think, oh, I just need to email them and ask for, that one didn't work, send me another one. Well, In those cases, something's happening in the background of their computer. So they do need training. So however you can get your physicians and executives to do that training, I would suggest you make sure that they are doing it as well. And then there's negligent handling of PHI. I think we all have heard of these scenarios and maybe even have them in our organizations where a business associate has caused something to happen that impacts you. Just one off the top of my head, if you think about, this is not healthcare, but the Target breach was a huge breach, and that was caused by a third-party business associate that worked with Target. And the thing that we also saw with Target, which we see in a lot of the healthcare breaches, is the information was there to be monitored. And you could have seen that there was someone in the system trying to do something, gathering information, but nobody did anything about it. And that's a lot of what happens here. So again, the training, the accountability, and then we're going to talk a little bit about monitoring. There's some types of things that can be done by your IT people, and you'll want to ask questions. Are you monitoring these things? So we'll get into that as well. I did want to cover a couple of things that are not so typical or that you might not know of. In 2016, there was an FDA precedent-setting guidance sent out about controlling IV pumps. There's a lot of remote control technology now, especially in the healthcare industry. But the very first one, which caused this guidance to come out, was a remote control IV pump, where someone got in and changed the drip on the IV pump. You can kill people by doing that, right? So these types of devices, especially when they're automated and have some type of Wi-Fi control, they have to have additional controls around them. For instance, if they're using Wi-Fi, you can actually secure Wi-Fi. Most places that you go, if you're sitting, let's just say you go to a Starbucks and you sit in a Starbucks and you use their free Wi-Fi, that's not secure. So if you're doing anything with information that is critical or is very sensitive, you're not going to want to do it in a place where the Wi-Fi is not secure. Wi-Fi that's secure will normally have a passcode that you have to put in it, and that passcode will periodically change, or it might be like a multi-factor authentication process where you use a token and it sends you a code each time to get in. But that's something to consider if you work with those types of devices. I also wanted to just let you know that healthcare providers have to attest to secure information exchange for the macro final rule. And what that means is making sure that you have methods of encryption where when you pass data across the information exchange between business associates and yourself, or even with your patients, you have to secure it in transit. We know that securing data when it's at rest by encrypting it is important, but in transit is also very important in the healthcare industry. Your second code word is healthcare. Okay, so why is healthcare data something that hackers want? Well, the industry tells us that a medical record is worth 10 times more a stolen credit card. I've lost a credit card before. It's pretty easy to call your credit card company and have that credit card replaced, and they basically give you a new card, and then that old card can't be used anymore. But if you don't realize you've lost it, then it can be used for a lot of different things. They can actually sell those credit cards. They can actually go out and buy a bunch of goods with them. the law will usually be on your side with a credit card. But with a medical record, the reason it's 10 times more is because everything is in that record, not just credit card information, social security numbers, demographic information, insurance information. So think of all the fraud that could be caused by that. Using somebody's social security number. What can you use a social security number for? A lot of different things. You can also you could have insurance fraud. Someone could try to use your insurance information. And then they could have access to your medical history. We all know that HIPAA requires that we protect people's medical information, diagnosis codes, and the history of what is in that record. And so the record itself, with all that information and the sensitivity of it, cause it to be worth a lot of money on the black market for a hacker. So what they do with it, they launch social engineering attacks, phishing emails. Obviously, they could use the credit card. They could use the social security numbers to get credit cards, right? They could use that to go out and get a new credit card in their own name. They just use your social security number or your patient's social security number. They steal the financial and medical identities of these individuals is what they do. They can hold your company ransom with that information. So if you need to get that information back, you want to control it, they can hold you ransom. And basically you're going to have to either, you can go to your backup to restore the information, but they've already got the information now. So what are you going to have to do? You're going to have to call the FBI. You're going to have to call authorities to help you. And then it's probably going to be a reputation risk because you're probably going to that's going to get out into the media. When the FBI comes in to help you, I don't know if any of you have been with an organization where that has happened. They've done it locally with a lot of healthcare companies. And I've spoken to several of them about how that works. Sometimes we wonder why that information doesn't get out to the public sooner. And you're like, why didn't they tell us about this sooner? Why are we just finding out 6 months later? Well, a lot of times, if that information were to get into the public, then that doesn't give them time to do their research, to go in behind the scenes and try to figure out who was doing this. A lot of times that those hackers have been in those systems for, like I said, well over a year. I think the average is 14 months that it takes to find a hacker that is ingrained into your network. And so a lot of times you find out through these ransomware attacks or through some other type of breach, and they've been in there all along. But the FBI has to have time to go in and do their research and go in and do the analysis to try to figure out who breached the system. If you notify the public, then that notifies whoever the hacker is or the breach identity is then put out on the media, and they can't really do as much after that as out in the public. So that's why they do keep it quiet for a little while. So what can we do? How do we reduce the cost of these incidents? How do we mitigate the risk of the incidents? There's several things we can do. I'm going to talk about a few at a high level, and then I'm going to give you some detail level ones. And these are things that you all can do, but the detail level ones are things that you're going to want to make sure that either your third-party IT organization or your internal IT organization is doing. And I'll try to give you some quick tips on how to ask those questions and what they should actually have in place. But you start with a cybersecurity risk assessment. And you try to get to a point where you know where you are, you know what your risks are, you know where your gaps are, you know that you need to put some additional controls in place around certain areas. And a maturity model is where you say, each year I'm going to go back and look at this and update this risk assessment. And we're going to try to fill gaps as we can. We're going to try to get more mature against our risk assessment each year. That's a maturity model. And you're trying to, one, get ahead, but also you're looking to the future and trying to find different types of software, hardware tools, et cetera, that you can get your board, your executives, your senior management to buy into. They're going to have to do that. You know, IT and cybersecurity is behind the scenes, but it is a huge cost to organizations if a breach occurs. It's a lot more cost if a breach occurs than it would be if you would just buy the software and hardware, put it in place, and secure your systems. I know that most organizations don't really understand that until they have a breach, but some of this information that you could see in these studies that have been done would tell you exactly how much more it's costing a company if the breach occurs than it would be to just pay to put the right security in place. Incident response plans and testing. I will tell you that behind the scenes, there are probably lots of incidents occurring that you don't know about. And so it's important for your IT organization to have an incident response plan. If something happens to you, for instance, and you get a, let's say a phishing email and you click on a link and it causes your system to lock up, you've got to call your IT department. That's an incident, and they have plans, or should have plans, on how they will respond to that. How are they going to lock down the system so nobody else will open a similar email, because usually you're not the only one getting that email. And then how are they going to restore the system, go to those backups and make sure that you can get the system back up and running in a timely manner. And then what are people supposed to do in the meantime? While the system is locked down, what is the plan for how you're going to capture the information so that you can put it in the system later and you don't miss anything? So if you're in the middle of your business day and you're working in an office with patients, et cetera, you're probably going to have to hold off for a few hours until IT can get that plan in action and they can release the system for use again. I know we've had that happen to us. And so we just have to be prepared for it. And that's part of the training. So when I say employee training, and I say everyone from board level to staff level have to have some level of training, it should be ongoing training. An annual training is very important, but some type of ongoing training. I know in our organization, we purchase the use of a tool, and they send us periodic emails and tell us about, these are the types of things we're seeing right now. It also sends us periodically a security slide deck that we have to go through. And we go through that slide deck and we take some tests while we're going through the slides, and we have to pass it, or we have to go back through the slide deck again until we do pass it. So you can purchase those types of things. If you don't have it in-house, you might ask your IT people about it. This system we use is called Know Before. And the 4 is the number 4, Know Before. And you can look that up. You can Google it. It's used by a lot of different companies, and there's a lot of different parts that you can buy different pieces to it and incorporate them into your training. But obviously, when you have new employees come on board, you want to train them too. So that annual training is for new employees, but also for your continuing staff. They need to do some type of annual training, and they need to sign some type of document that says they understand their responsibility for managing the potential of cyber and social engineering tactics. Business associates also have to be accountable. So some type of accountability program for your business associates and what they're doing and how they connect with you. You want to know how their security works. You want to also have some type of a vendor management program for third-party vendors even if you're using a network security vendor or someone who supports your network, and they have that at a third-party data center, you want to manage them and what they're doing. So Lucy mentioned that my team does system and organization control engagements. That is an attestation report. Some of you may have heard of it in the past called a SAS 70, but now with all the technology changes, it's much more intense around information security and privacy and confidentiality. And so those vendors, network security vendors, should have a SOC report. And that SOC report is going to, you look for exceptions. Any exception means that it's been tested and they failed the test. So some type of security failure or privacy, in the privacy area, there could be some type of control that failed. And you want to know what those are, but you also want to know what are they doing about it? Have they already resolved it? Did they also have to report in those, because it is an attestation that management is providing to their customers. They have to tell whether they had a breach or an incident that impacted their customers. So you look for that as well. Those are very good reports. They have a lot of good information in them. That's one way of managing your vendors. So here are some other things. Threat sharing within the industry. And so there's a way of doing that. There's a site called Healthcare Info Security. Healthcare Info Security. And that is a site that I actually belong to, that for both the healthcare industry and the financial services industry. And I get an email once a week, and it has information in it about the latest and greatest hardware and software tools. It has stories about breaches that have occurred and what the process it has been for resolving those breaches. It's just a lot of information sharing. And that is also a group that you can get into, where they have user groups and you can share information back and forth. I would encourage you that if your IT organization is not already doing that, that they get involved with some type of industry sharing organization, that they can share info, they can get information, and that helps them to develop training for your team. Again, board and senior management level involvement, meaning not just the training, but involvement in the solutions for cybersecurity, for cyber risk, involvement in decision-making around purchasing the right software, purchasing the right equipment, and employing the right people. I'll just be honest with you, especially if you're not using a third party. You know, if you're doing this in-house, you need to make sure that you have someone who is versed in information security. And usually that's a chief information security officer. Might be a system engineer, but they have varied titles and backgrounds, but you need to make sure that they have that knowledge. And then obviously, we want to have a business continuity plan, meaning if something does happen and your system gets locked down, it kind of goes back to that incident response plan. What is your organization going to do in the meantime? How are you going to get back up and running? And what is the maximum amount of time that you can be down and still support your business running? So those are the things that have to be considered in a business continuity plan, and they need to be tested on a regular basis. Disaster recovery is similar to business continuity, but this would be more around, what if there's a tornado? I mean, we had tornadoes last year, and that put a lot of businesses with their systems out for quite a long time. So what are the recovery points? How do you recover if people are going to have to work remotely for a period of time? How do you get them up and running? So we've had a lot of experience with that in most industries over the last year and a half. So that has helped a lot with the business continuity and disaster recovery plan testing, because we've had to do it in actuality. but those plans are very important, and testing will often show where you have weaknesses. And that's where you go back and you update and implement additional procedures within those plans. If your testing fails or your testing shows that you have a weakness somewhere, you want to make sure and go back to the plan and update it and put something in place to address it. Insurance is a big thing these days as well for cybersecurity. But you can't just have cyber insurance. You're going to need to have other types of insurance. So I've listed some of those here. I will say that cyber insurance will not help you if you don't have these other controls in place, because the cyber insurance policies are going to say that they will not pay unless you have these basic controls in place. These are some of the more detailed things that can be done, but these are the basic controls. Data protection, advanced use of encryption in healthcare, that is something that should be second nature. Again, it should be, your backups should be encrypted, your data at rest should be encrypted, your data in transit should be encrypted. Data loss prevention, there's software that can help with that helps you in making sure that even if a ransomware attack captured data, they can't unencrypt it. That prevents data loss prevention as well. Logging and monitoring of third-party access. So a lot of people, as they work remotely, have been accessing a network through a VPN. There's much more layered security that has to go along with a VPN and other third-party access. So that's why, we say layered security is really the best way, meaning having multiple types of security, and we'll get into that in just a moment. Backups and being able to recover those backups, you have to test the backups periodically to make sure that they will be recoverable when you need them. RTOs are recovery time objectives. That's just, again, saying what's the maximum amount of time that we can be down without our system and the business still be able to run. We talked about malware protection and antivirus software, making sure it's current, and then that patch management program, making sure that upgrades and updates are getting implemented and patches are getting implemented timely. One of the things that we do recommend, it doesn't matter if you have IT in-house or you're using a third-party provider, is a network assessment and penetration testing, internal and external penetration testing, wireless testing. There's software that is used by usually a security engineer or system engineer. We come in, third party comes in and does an assessment of the network vulnerability. And we look for ways that any party could get into your network externally. Is your firewall set up properly? Are the configurations set so that external resources and sources are protected? Then the internal side, this is a way for you to find out if you've got some missing controls or if you need some additional monitoring or procedures in place. On the internal side, you have to be able to get in through the external side to be able to do anything from the internal side. But you want to make sure, even if your external security is very good, that the internal security is good, because you could potentially have a disgruntled employee or someone in IT. Let's just say someone from IT left. They take a new job and they had the keys to the kingdom. They had access, they could get in through a VPN. They had an ID and password that lets them change things within the system. And they left. In your termination procedures, so you see that as the next one, termination procedures weren't effective or they weren't timely. Maybe you didn't take that person's access away the day they left. And we find this often. Again, that is probably 90% of our clients have some problems with that process. It between IT, HR, and whoever has to do the termination, it's not occurring timely and effectively. So you need to make sure that those procedures are working. And then strong, complex passwords. We talk about passwords a lot, but passwords, they need to be something that no one else would be able to guess, and they need to be complex. So meaning at least 8 characters, not just letters and numbers, special characters. I have a password for one system I have to get into that's 16 characters long. Let me tell you, that is hard to remember. So you have to come up with creative ways to remember those passwords. Layered security includes multi-factor authentication. I hope that most of you today are using multi-factor authentication. That could be a piece of software that you have that your IT people have given you, and you download an app on your phone, for instance. And when you try to log in remotely, then it's going to give you that multi-factor code that you have to log in. But you need that as well, even when you're sitting in the office, because multi-factor authentication is just another layer that someone would have to go through if they were to get your password and ID. If they don't have that key or that factor, they won't be able to get into with your credentials. If they captured your credentials somehow, they don't have that piece of the code. So that's part of the layered security that keeps them from being able to get in. Talked about the multi-factor, adequate firewall configuration and monitoring. Again, your IT people or your third party should be doing that. That vulnerability assessment that I mentioned earlier that you can have a third party to do, that will tell you, they can look at firewall configurations and they will tell you where there might be weaknesses in that configuration. They'll also look at what type of monitoring is being done. A lot of times what we find is if you don't have the right people in place, they won't know what to look for. There's a lot of information that is coming out. There are a lot of alerts coming out of these systems. Just like the IDS, IPS, that's identity detection and identity prevention systems. If they don't know what to look for in those monitoring reports or alerts, and they don't know how to follow up on it, then nothing will happen. That's what happened to Target, for instance. All that information was there. You could see that when the FBI went and backtracked into their system, that was in their monitoring logs that was occurring. There was someone in there doing something, but they didn't look at the monitoring reports, or they didn't know how to read them and report it. So you do have to make sure that you have appropriate people with appropriate education and knowledge to be able to do that. And then they've got to be able to follow through. So in conclusion, I just want to go back and say the first thing that you should start with is a risk assessment. So cybersecurity risk management and mitigation, it's an ongoing thing. It's a dynamic process, but you can start with that risk assessment and then on an ongoing basis, relook at it, make sure nothing's changed. Have you had additional risks come into play during the year? Have some of the risks been mitigated in some way with a piece of software or some hardware, or you've hired a new person that's monitoring various areas that you didn't have before? That is a very good way of continually maturing your cybersecurity management program. Managing the risk on a daily basis, really. Those monitoring reports and alerts are continuous. Some alerts can be set up to be sent to an IT person 24 hours a day. That's why a lot of IT departments have someone who's on call, and the on-call person would get those alerts, and then they would know, okay, I need to go shut this system down right now. So whoever is in it can't do anything else. And then I've got to figure out what happened. It also has to be a strategic business and imperative. So you have to spend the money on it. Unfortunately, you have to spend money to keep from losing money here. And then you have to be trained continuously. It's an ongoing, continuous process. That annual training is important and needs to be done, but there has to be some type of continuous training. When IT sees various incidents that you don't see, it's behind the scenes, they should be periodically saying, we've been seeing a lot of X, Y, and Z. This is what you need to do. Or our IT department will often send out and say, if you get a message like this, delete it, don't open it. That's what you want. That means they're monitoring and they're trying to keep a handle on it. I am open to answering questions. I know we have this last code word for CPE, which is October. But does anyone have questions?
Gina, I don't see any questions in the chat box. If you do have a question, you can raise your hand or type in the chat box.
Feel free to type in the chat box. I will say we
had a couple come in. Gina, the first one is, are the steps taken for securing healthcare data a best practice for securing data for any potential client?
The types of controls by industry are very similar to the ones we've covered this morning. I would say that healthcare and financial services really need to be working along the lines of best practices. For instance, encryption is much bigger in the healthcare industry than any other industry. Making sure that your encryption level meets the standards that are required by HIPAA. There are various levels of encryption, for instance. The lowest level is 124. The highest level, I believe, would be 526. You can be at that middle point, but you need to make sure that you've got other layered security on top of it. And if you're having a HIPAA risk analysis each year, that's one of the things they should be looking at, if that's part of the privacy and security rules, and it would be tested during the process of doing your HIPAA risk analysis. But yes, I would say that healthcare is a best practice for other industries, or the types of controls you should have in healthcare are best practice.
Thank you. I have one more question. What security measures do you recommend to prevent cyber attacks of PHI data?
So we covered some of those already, but again, the encryption, the multi-factor authentication, making sure that you have systems in place like a security information and event management software, that somebody's monitoring that there are alerts set up for your IT people when various things happen that shouldn't be happening, like someone trying to attack your firewall. All of those things work together for that layered security approach to keep PHI and PII secure.
Gina, we do have a question that just came in. We do get files, text, EDI, Excels, PDFs, etc., from different sources, which include clients' data. Any standard practice to make sure the file is not infected? We do antivirus scanning, but is that enough?
It depends on whether your antivirus is current. Antivirus scanning will help. There are other IT products that your IT department can put in place, like those identity prevention and protection systems that can, when those emails come in, they run it through it. I know ours often gets quarantined if it has something attached to it, and we have to go out into the quarantine and get it out. Or sometimes we actually have to go to the administrator, and the administrator will check the attachment and make sure it's secure in what's called a sandbox in the IT environment. And if it is secure, then they'll release it to us.
One more question. What is the best practice for giving employee training on IT security, internally or through a third party?
Both, a combination. Really, there needs to be some hands-on customized training for your environment. And there needs to be that third-party training, like the thing that we use that periodically we have to go through and test on various types of topics like social engineering and the types of attachments and emails to be leery of. That's what the third parties are good for. But the internal training should be customized to your environment and things that you need to know based on the software that you use, based on what your IT people expect you to do. If you are concerned about an attachment, what they're doing to manage those attachments, and what the security levels are within your organization.
And I believe we have addressed all of our questions. Gina, thank you so much. That was excellent. And we will be providing a recording, like Debbie said, and copies of the slides.